breathing in.
I don't know if I should just the way. No, I don't know.
Yeah, you're not going to have a problem.
Did you want to say your Wow. I think we have a reserved spot sticker for myself?
Yeah, you said your blessing. Sure.
Welcome all. We obviously don't have a quorum, so we're waiting for Commissioner Anderson, Commissioner Brinkerhouse up north. So we may just have a discussion. We may not have an official meeting. We can't act without a quorum. So hopefully taking on his way.
We have a microphone we can do karaoke.
Hey, I'm your first.
Nobody wants to do this.
I appreciate it.
Yeah, we're planning on next summer. I would assume so.
You certainly cannot. Did you get it? She's amazing. 20 years older than her and 300 pounds heavier. I don't think so. I don't know. You make sure you can share. I would be there with them.
We got a quorum. No, but where's that? Yeah, we need that jar. Oh, Adrian?
I don't have any programming.
I think Jeannie was calling.
We'll get there eventually.
I just got answering already.
They must be in her house.
I'll just call them through a message, but
Well, the one he has is no, you're the trip. But anyway,
My alternative.
I apologize for the delay, but we really do need HR here so we can have an educated discussion. So continue to visit.
We're
Here we go.
You're videoing us?
Clear.
Man of the hour. Made it.
Oh, yeah.
I'm still trying to get used to the time between.
Oh,
Cedar, yeah.
I was trying to.
I have less heroin. 20 kills.
22. All right.
Without speeding.
Maybe pushing it right to the limit.
Oh, just got an 80-mile-an-hour speed limit.
We won't see what I was going.
We do have law enforcement.
Allegedly.
Dale, I'm allowed to put my tie on, but I'm not allowed to talk on the phone, right? Yeah, no texting.
Do not
You do anything but text. You know, yeah, you're like, you can do anything once.
Welcome all. We've got everybody here now. We have a quorum. Mr. Brinkerhoff is up north and won't be here. Oh, I need to start over? Sure. I didn't say we could do it. Anyway, welcome all. We are now convened in this special meeting of the Iron County Commission, Wednesday, October 19th. One item, the discussion of possible decision regarding the employee insurance 2017. First of all, John, if you lead us in the pledge of allegiance, and this one is
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Our Heavenly Father, we're thankful for the opportunity to join together this day in the beautiful town of Fairlawn. We're thankful for our friendships and the opportunity we have to be able to work together to serve the people of Iron County. Please bless us at this time and we'll be able to make wise decisions out of better understanding the issues that come before us. Please bless us that we can be respectful of each other's thoughts, value each other. We're thankful for the opportunity to have to be able to serve in these capacities, for the lives that we live, and the blessings that we have, and the reside in Iron County. These things in the name of Jesus Christ. Amen.
Okay, first question we have, Commission, is the deadline. We called a special meeting in terms of the deadline. Mr. Rickerhoff can't be here. I guess he took the vote over the phone, but maybe you could explain to us more how close we are on the deadline. We could wait to vote on Monday or resolution.
No, I think the request was made just because we're considering some substantial changes in terms of how we just need the extra time to administer those changes in terms of open enrollment, to make sure everybody's gets the explanations, their questions answered. There's some obviously some administrative work that need to be done on the IT side, enrollment. I mean, we just knew that we would kind of bump up against the deadline, and just any extra time was going to help smooth
The
out.
deadline is November 1st, is that right?
We want to start open enrollment November 1st, and then, I mean, that's the plan. That's what we do.
We haven't yet. If we put off the voting, we'll have to move open enrollment to later. The week we have it is the week before Thanksgiving, essentially. So if we bump it, we're going to be 1st of December before we're doing open enrollment.
So how long does that give them?
That's late.
December 1st till then.
We have to keep it open for 30 days. So if we open December 1, we can't be finished in time for it to be effective January.
So it's in 5 or 6 days now.
That's huge difference. Because they'll need 2 to 3 weeks to prepare our slides for the open enrollment.
I think in addition, if you're making large changes, you have to allow people opportunity. Open enrollment, you can worry about Iron County, but if you're changing coverage, like my husband's open enrollment doesn't follow the same time period, so you have to allow as much time as possible. We've scheduled a meeting, it's noticed, I don't know why we would postpone anything.
Any other input? Well, and Mr. Breakoff did say he was going forward. He wanted to
Can you clarify again just real quick, how come adding Thursday, Friday, and Monday would cost us weeks? 3 business days until our next commission meeting. Why would that cost us weeks?
It's just as soon as we get them the information, we'll start preparing the site. But those 2 weeks to be ready to go, by the first of November. If we're not, then we're going to be pushing this. It's like that does our enrollment. They have to prepare the site. If we have changes, they have to make those changes. It's going to take them longer to prepare than just changing a little bit of information. So the more changes we make, the more time we need.
How long have you been working with them?
3, going on the 3rd year.
Have they been finishing it?
Yeah.
What benefit is there to waiting till Monday?
Well, Commissioner Breakoff, you want to know why we're in the hurry, so that's why we have this meeting, because that's why we have a special meeting. And we said, well, we also said that he would do that over the phone.
He was under the impression that this was going to be a discussion. He wasn't aware that the vote was going to be taken. So there was some confusion there. Personally, I would feel really bad and take the vote if somebody wanted to be here, especially where it's just 3 of us.
And why is he not willing to listen to the discussion that we went through without
I think he's willing to listen to the discussion. I think at the time, I think he would anticipate that it would be quite a long discussion. So I know that he's up in Salt Lake and busy with things, so it would be difficult to listen to a long discussion. And I think we can all probably relate to that. So I don't think it's that he's unwilling. I think it would be difficult for him to participate in a lengthy discussion.
Well, let me just be on the phone.
Well, let's talk through this and see where we're at. You can always call me. He said call me.
I just
have something before we, go through the new proposal and everything. Is there any way possible you can consider the first proposal that we need?
I don't think so.
it's possible, but
I just really feel like we really worked hard, we really put in due diligence to get those numbers down to 10%. I've talked to some other counties, cities that say, they automatically budget each year for a 10 to 15% increase, just knowing the French insurance that they're going to need to have that extra money budget for this. So I just wanted to see if that would be a consideration.
well, we definitely thought over through the talk team that's in with the HRA. looks good to us, and it makes a lot of sense, and I think we appreciate the effort for the nation to do that, and you know, make changes in the vision, so we have an employee contribution there, but then the county covers the whole 10%, so we don't want to ask the employees, you know, how to little pay except for the dental and vision. And I didn't get the total, or how much is it per paycheck would be covered in
It's we figure it's about 184 annually, so that's just not per
It's $13.66 per bank.
13.66 per paycheck.
For the 24 pay period, not the actual.
So 327.84 per year.
For a family, no.
That was per family.
And that's for dental and or just?
Yes, dental and vision.
Yeah.
Nicole, I know I received a lot of very positive feedback over some of the things that are going to be now available with the new proposal. So, whereas before it was just kind of maintaining the status quo, now he picks up 100% of the increase, 10%. It's just kind of the status quo just moving forward. The feedback I've gotten with some of these options that are available, people really like. So, I think this sort of thing makes a lot of sense.
I don't have any employees that have an HRA, so I suppose you guys have pretty better communication and are feeling positive and good about that.
I think our biggest thing that I'm seeing is they're concerned about next year. I think that's the biggest cost.
And what does that mean exactly?
Is it going to stay the same? Is the amount that they're going to give for the HRA people who are right now capped, is that going to stay capped? People opt out?
Well, someone said to me this morning, you know, people want a guarantee, and I said, well, there's no guarantees in life, you know. But, and one commission can't bind another commission. We'll have a new commission in January, we'll have 10. So, but I'm not saying that to say that I have this thought that we're going to slash this thing next year. I'm just saying that we can't guarantee anything. But I think because of the benefit that's coming from that, I don't know why we would want to stay with that. You know, Aileen, could you explain the HRA options to us all so we all have that, we're all on the same page, how that would work, and how much each person, the people that renew their HRA would be paid monthly, and so on?
Well, there's
Adrian, just so everybody can hear you, you wanted to stand up.
look,
Maybe about the line.
okay, yeah, I might have, Rob present with me, that's okay.
That's great. Yeah,
he's an excellent resource, and
perfect.
I'm trying to educate myself the most, the best I can, or the best I could through this process, but I've already misspoke in terms of the question about the dental. Let me correct that first, just while I have it on my calculator. But the dental and the vision, taking the vision piece into it, because that's part of the 25% employee contribution, it works out to $11.95. That's per pay period. Keep in mind there's 24 pay periods that account for benefit deductions.
Is that including the anticipated 5% reduction?
Yes. So I recalculated that really quick. So that's reducing the dental contribution by 5% because it's currently overfunded, adding in the vision piece, and then 25% of that was how into that calculation. So Minimal impact, but it's
So we heard
it's
13
a contribution nonetheless.
But it's actually 11 something,
1195.
and that's for both.
That's per pay period.
Family,
And family, but we just make that off the highest, so family.
and then it will be lower for
So it's 286.80 for a family. For that up 11.95 or 24 for 24.
And then, so and then that 11 is off the 26, but really taking into account that there's two that, right, so it's a little higher, but then there's two without a deduction. And then getting to the part of the proposal, if you will, that has to do with the HRA. We'll just eliminate the existing health reimbursement account or HRA plan and instead offer an opt-out benefit to employees choosing to waive coverage that may be considered redundant or unnecessary. We understand there's a few different scenarios there that as to why people have HRAs. And we tried to take into consideration and try to educate ourselves in terms of those different scenarios. But there's concern, there's question. I mean, this is probably a good environment to discuss those things, and especially with Rob's expertise here. But what really sparked that discussion to begin with is just keep in mind that without employees paying any contribution at all in previous years, and that's great, that's excellent. There's no incentive for, I'm not even sure if incentive is the right word, but there's no downside to an employee enrolling in coverage that may not be used to its full purpose. I guess it might be that they have opportunity to have access to secondary coverage, or there's a few different scenarios there, but the county continues to pay a full premium that may not be providing the benefit that was intended. And again, there's exceptions to the rule, and that's why we're just throwing it out there for discussion. But in terms of a plan that we think would not only benefit the county but also the employee, it's not just taking that benefit away. It's and we don't want it to be viewed that way because benefits, we understand, are a big part of the employee's total compensation package. We never just take that away without trying to make it work for the employee as well. So we're figuring in this opt-out benefit to where if an employee, because they have, we don't ever want to leave an employee uninsured. We can't do that. We don't want to do that. But in an event where they have access to other suitable coverage, it's affordable, it's coverage that they want and are happy with. The county, if they waive that coverage and the county doesn't have to pay that premium, obviously there's a substantial cost savings for a family. And we're looking at approximately $1,200 per month. Multiply that by 12 for an annual cost. You can see that's a substantial investment, right? The county, by that premium going away, would benefit substantially. But for the opt-out benefit, is being proposed to where the employee, by doing that, would receive half of that premium savings. Okay, and that and covers the amounts for a single person. That's $259.10 per month. Two-party, that would be $531 per month, and for a family, it'd actually be $659.05 per month.
And while you're right there, how would that be paid out? Would that be paid as wages and Social Security blanket?
We've checked with one concern that was brought up is how that would affect retirement calculations. For example, it would be paid out as discretionary compensation. It wouldn't be paid out as wages. It's not necessarily a bonus, but I guess it'd be closer to a bonus than standard wages.
So it isn't subject to FICA, or it is?
It is, it would be taxable. Yes, it is taxable wages, but a person, it wouldn't be subject to, well, the big thing was, it wouldn't add to a person's retirement compensation, if that makes sense.
And roughly 60%-ish of the counties throughout the state offer an opt-out option, and that's what they call it, you know? Discretionary.
Yeah. I mean, it's as part of just researching this option, we did check with each county in the state. The responses from the counties that responded. That's what Mr. Anderson's referring to is. This isn't a unique thing. It's something that's being done by other counties already. Approximately 60%. And yeah, that's generally the term that was used is an opt-out benefit or something very similar to that. So again, taxable wages, taxable compensation, no retirement implications, but substantial savings to the county. And a good incentive for the employee. Again, if the fit is right, we're not looking to take away coverage when it's needed. It's not a benefit that's being taken away. It's just there are situations where it just doesn't maybe completely make a lot of sense to insure a person that's not going to get the whole benefit of the coverage. They would benefit more by getting compensation added to their paycheck.
Can we see a raise of hands of who is considering an opt-out option? It's about $8,000 a year that you would be receiving if you opted out.
First of all, raise of hands or who's on an HRA. Everybody that's on an HRA. So we just got 2 in the room. 3. You got 3 in the room. Okay, of you 3, how many would consider doing this new option? Margaret, would you consider doing this new option and just leaving the cash?
No, I'm not 100% opposed to it. These are all new to me. I haven't really had
Okay, so we've got 2 out of 3 here that say that they would do this and 1 undecided.
So Margaret, just to give you an idea of
consideration, but I would consider, I'm not 100%.
Yeah, I would certainly consider it.
Margaret, just to give you a rough idea, the reimbursement account, we limit what you can reimburse up to $2,400 a year, correct?
In the reimbursement account, they only get the 1,000 or the.
But it can bill out to 2,400. Right.
The HRA, there's a cap in there of $2,400 a year.
And we would still have the ability to.
Not if you opted out, but there's a cap of $2,400 a year. If you opted out, you'd be getting, I think it's $7,900 a year in additional compensation.
But if you're
If you're a family.
Okay, there's 2 people at 531
Correct.
per month, right? So for Margaret, you would have 6372.
Would this be option be available to HSA?
Anybody can choose to opt out.
Yeah, we should note that, right? The idea simply would be anyone that opts out, right? Really did tie simply to someone that's opting out because of the HRA. They might be opting out. The other coverage they have might be a qualified high deductible, which allows them to get the county HSA contribution. So now they're giving up the HSA contribution, opting out, right, and getting the opt-out bonus. So the calculations that we've looked at and discussed for the past 9-10 days, we made some assumptions what you have to do when a situation like this. And there's 21 folks total that currently get HRA contributions. I know the figures that we're all looking at are based on all of those folks saying, you know what, this math works in my favor. And I think most will find, even in situations where maybe you're opting out, maybe you have it now because you also have Medicare. Opting out means you're going to have to buy supplemental products to supplement Medicare, right? We've had some discussions. I know we all have with some folks in that situation. And I think the more you think about it, the more you start to realize this is pretty attractive deal, because I'm likely insuring myself now only because it's free and I'm getting some money from the county. Who wouldn't do that? Right? Who wouldn't take free insurance and get an HSA, chunk of change in their HSA or HRA? Right? Who wouldn't do that? Well, I think that's a fair question. Now the alternative to this then suggests that it's a great one. I mean, we left here last week with the homework of finding some other ways to save money. And I think this is a great way, and it also speaks to a strategic way for the county to realize, we don't need, it's not in anyone's best interest, if you will, and even speaking this, will insure themselves when they really don't need it. And I'm not speaking for everyone. There likely could be someone that has double coverage is working for them, but oftentimes double coverage doesn't do much for you. Okay, when you enroll in this plan's primary. Okay, so Select Health is already primary payer for every single person insured. So the secondary, there's been suggested to me that, hey, we might lose some healthy people on the plan. I don't think that's true, because Select Health is already paying all the claims for everyone that's on this plan, even those that are double covered. So,
only saving premiums, is that the rule?
Select, say again.
That we only save premiums, essentially the payout is the same as that we do.
Correct. The savings to the county would be the premiums paid by the member who chooses not to enroll, okay? And also, of course, the HRA or HSA contribution county.
Do you do this for a living? And I'm sure you work for the counties, and 60% of the counties in the city are doing this type of thing. Do you have experience with other counties doing this opt-out kind of thing?
Other counties do them.
Okay. I'm just curious. I haven't had a chance to research what their experience on that is.
I didn't really realize till now that people on HSA can also do opt-out, so we can have a lot more.
Yeah, I guarantee you that you'll have, well, I know you do, you have at least a handful of people who are buying the plan, who are double covered, the other coverage they have is a qualified plan, so you're still allowed to give them HSA money. And that person who looks at this option and says, hey, I'll forfeit my HSA contribution, which is here, but I'll get this opt-out bonus, which is here. What doesn't work with that? And what doesn't work with that math?
Yeah.
Lieutenant Sponsor, I've heard that we have more HRA individuals in the sheriff's department than other areas. Have you had any feedback on that, or any? You guys? Sorry.
We've had quite a few people who have HRA who have expressed interest in this. Our guard members who have
The TRICARE.
exactly access to TRICARE. They are very interested in it. This will be able to pay their premiums and then have a little bit of money actually left over. So that's very attractive to them, as well as we have had quite a bit of interest expressed from people who have their spouse has like an HSA and now they're seeing that they're going to be able to channel this opt-out benefit into, an HSA account and then they'll be able to make a high deductible. Make a lot more sense for them as well.
So somebody whose spouse has an HSA, it's potential tax write-off.
Exactly. So not only do we have a lot of people who are really excited with the HRA, but a lot of people who are really excited with the HSA as well from the sheriff's office.
So to clarify, that money, that opt-out bonus can be transferred right into another of your spouse's HSA tax-free.
Sure. So HSA, one of the many people know about HSAs is they're quite flexible, right? If I'm an Iron County employee and now making more money, so now I potentially have more disposable income, I can choose to do whatever I want with that. And that's a major part of the opt-out benefit. I'll just add this in there. You can't, that's employee money. There's discussions out there that where a company or a county will try to dictate how that opt-out bonus is used. You can't do that, right? It's their money. So as they now have extra money, they choose to do what they may, and that's a great point. The more money you can contribute to an HSA, the better. And for multiple reasons, but connecting the dots, the more money I contribute to an HSA through payroll, everyone wins, the county wins and the employee, right? So that additional income, right, should potentially could allow you to make a greater HSA contribution through payroll. And again, the county will make those payroll taxes.
So the overall reaction to Sheriff's
hold on.
Department
I really would like to make it all today, so let's get Commissioner Brinker on the phone, if at all possible. He's just gonna have to maybe and get a few of these key points that we've made. Because he really needs to hear these key points before we vote.
Just to clarify on the HSA, it's not tax-free if you take the discretionary money and write a check into your HSA. That's not tax-free. It's already been taxed. What you could do is increase the amount of your payroll deduction equal to whatever that discretionary money is, and then it would be tax-free going into the HSA.
But how do you do that if it's your husband's? Because that's my.
I think that's the clarification, I think.
That's correct. I don't think you can do a payroll deduction into somebody else's HSA.
Yeah.
No, that's
So
not
if they
right.
take out the HRA, which is the only option if your other coverage is not a high deductible plan, then you do not have that option. It's got to come as a wage. Is that correct?
Yeah, I've had a couple thoughts. If my husband works at the ABC company, I work here. I'm enrolled on the health plan now, and I get this HRA or HSA money that goes away. And when I get this opt-out bonus, so my pay goes up. Okay. And I want to contribute more to the HSA now. Okay.
The HSA on my husband,
Right,
because there is no HSA.
Right. So I want to contribute to my HSA. A couple ideas, right? Have your husband contribute more to his payroll,
Right.
which he should be able to do now because he's looking to use it. He's got all the money. Right? So that's what I would
Just trading knowledge and saying,
yeah. But and then one last point, that certainly is the best, most advantageous way to contribute to the HSA through payroll. You can do it post-tax. The downside of post-tax is two things. You don't get the advantage of the payroll tax savings. And you have to remember when you file your taxes to take the above-the-line deduction. So you can certainly get the income tax savings on a post-tax deduction. You just have to remember to tell your CPA, hey, I made $10,000 last year, but I also made $4,000 in post-tax HSA contributions. So at the time of tax filings, they'll take the $4,000 off your $10,000 income, now your tax on the 6. So you'll still get the income tax savings when you do it that way, but you'll lose the payroll tax savings.
Okay, hold on. Let's get Commissioner Brinker on the phone.
For 2017, $6,750 a year if you're taxing.
Can you increase your flexible spending? You can't roll that over, but you could use the same thing as flexible spending, right?
There's no
Still have
flexibility.
Those are separate.
There's no more money.
We have for dependent care. It's not just dependent care, because I can use whatever you do.
Your 401. No, we do have another flexible spending for medical that is, it's not offered to those with HSA.
It's not?
With HSA.
You can't have it.
Only if you have an
Yeah,
HSA,
and
you
flex.
can't have flex.
So if you have an HRA and you get rid of the HRA, then there is no way to contribute to that?
Well, you should still be able to do flex spending, right?
Yeah, that's what I'm asking.
Yeah.
If you still take it out for tax, you're on money.
Right.
Can someone just explain for those of us who don't know what the flex spending?
Flex spending is an account that you can make deposits into with a payroll deduction, similar to the HSA, but they conflict, so you can't have an HSA and a flex. Yeah, so it's limited, the flex spending is limited now because most people have the HSA. There are a few who have the HSA. So we have a dependent care and we have a limited flexible spending account for those who have the HRA and want to contribute.
Is there a max on that?
Well, the IRS will let us know
Yeah.
500.
Okay, is there a safety net? Okay, you relinquish your HRA, and then all of a sudden your spouse has your insurance. Gets fired, loses their job. What's the safety net? We're going to take it, as soon as they need the insurance, we're going to take it back. But would there be any interruption there?
For the IRS, it's a qualifying event. You lose coverage for your husband's plan on February 28th. They're eligible to start here March 1st, and therefore we become eligible again for the HRA for the state on 2020.
I want to make sure that that's a really good fund. And the opt-out would be offered each year. So if somebody chose not to do it this year, you can do it next year. Is that correct?
Can you choose each year?
You can go either way?
Yeah, like change my open enrollment, yeah.
What about for those that opt out, is there any reason or is it legally possible to do something like a cafeteria plan that employees could do and put that money to work at that point, or is that just not legal? I mean, I know that there are implications of HSA, HRA. Would a cafeteria plan make sense for people to opt out that they can contribute to pre-payroll?
Yeah.
Is that something that's even better?
Yeah. So if I'm an employee here and I choose to opt out of the health insurance and getting the opt-out bonus, okay, but I still want to put some money away for e-tax, okay, then the request plan would be the way to do it.
But there's a limit to it.
$2,500 a year.
Yeah.
And you have to use it, right?
The IRS does. One good thing about the Affordable Care Act, you can roll $500 a year over now. You have to re-roll, of course.
They used to zero out.
Yeah, you said to zero out. So give a little bit of credit to the Affordable Care Act. That is one of the.
So is the opt-out an option for single at all, if they were to find their own insurance?
Yeah, you opt out of that thing.
It starts last.
We want to emphasize again that we want the employee to be very educated in terms of all of their options, right? It's not just the county trying to take a benefit. I can't emphasize that enough. But if it makes sense, it's available to every employee. And we want to take that a step further, and we're probably going to require proof of coverage and some kind of statement that acknowledges that should you use all of your reportable income in terms of if you go to the marketplace, for. I mean, there's some things there where again we want to make sure we're not giving the impression that it's hiding anything. It's just we think it's going to be a good product. We want some, that's going to benefit both sides. But if it's an educated decision and it works, then yeah, it's going to be available to every person.
Yes.
I remember there was hearing where John made a comment about other counties already doing this. How does that affect recruiting power within those counties? How does that affect my employers' money?
Recruiting for new employees?
For new employees.
Let me just back up just a little bit first. In terms of the counties, again, I reached out to every county in Utah at the very beginning of this process. I didn't hear back, which is very common. I only heard back from a bracket, I would say probably less than half, maybe close to half of the 29 counties. Of that half that I did get a response, the responses I received, I'm estimating 60% of those they have plans that are similar to this because they've seen benefits associated, just how we're discussing here. So I want to be very careful to understand that I'm not assuming that 60% of all, it's just what the data that I was able to collect. So I'm just saying we're not alone in pursuing this option. But this is, I will say that this is on the generous side, and in fact probably one of the most rich plans in terms of the opt-out dollars, if where you put it. So I would, to answer your question, I would say it should be a recruiting tool, and that's something I haven't thought of, but it is a way to just put more dollars in the pockets of guys that may benefit. So again, I mean, we would want to see, it'd be interesting to kind of have a discussion next year to see if it actually did lead to, some improvements, but my initial assumption would be it would be improvement, because in comparison to what's already being done by others, this would be, again, on the rich side of things, in terms of dollars contributed.
I just think it might be good to remember kind of where we were at before. The 10% increase in premiums was estimated to cost $192,000 a year. If you look down with the updated numbers, the net increase in benefits to employees is $87,000 a year. Increase in benefits to employees. And really, it's hard to call it a benefit now if it's an additional compensation that you're receiving your check. I mean, that's money. Increase in money to county employees is the biggest portion of this. It's that and the HSA restoration. So the fact that we went from $192,000 and we're meeting in the middle, rather than the county picking up all $192,000, right? We're meeting in the middle. It doesn't get any better than $87,000. That's right about 50%. So I'm really excited with these updated numbers. I think it's a huge recruiting tool.
I agree that it's, at least for us, it's going to be at least a retention tool for my office, at
Right.
least.
Actually, they go hand in hand, right?
Commissioner Anderson, I want to thank you for putting that money back in the
The insurance committee meeting, I was very excited to attend that. I think it was such a productive meeting. We came together. We found that 10%, instead of just arguing over that one issue, let's identify some other things that we want. And as I've talked to county employees, more flexibility is always better. More options is always better. I'm tempted to go lobby 104 legislators and the governor to try to get this for state employees. State employees would be like, I mean, this would be fantastic to have. I've talked to people even that are on the HRA about this. Out of the 4 that I've spoken personally to, all of them said it would benefit them personally. And the biggest reason why is because we're still covering the 10% increase in premiums. We're still covering the 10% increase in premiums. So they like hearing that they're not going to have to shoulder that burden of the increase in premium. Even though they might be losing the HRA benefit, they don't have to cover that. So,
Because the HRA benefit, they're no longer on insurance, those are not.
well, you can lose the HRA benefit but still be on the insurance. Right? If you opt out, you're opting out of the whole package, but you're still losing the HRA benefit. So, I think it's.
So you're a state employee, right? And you probably, is that your insurance more favorable for you?
No.
Do you use our insurance?
No, well, because this is temporary.
Right.
Sorry.
Let me just pull that out. I'm wondering though, all things being equal, long term, would this be would that be a positive? Would this be a net positive for you and your service?
Yes. Yeah, it would.
If you opt out, not to use what you on the how would you still have a...
If you opt out, you cannot be on the HRA.
Okay, I understand.
But you can still be on the insurance and lose the HRA. The HRA is supplemental to the insurance. It's a separate thing.
So you would go over the 810 thing?
So if my spouse had insurance, I had insurance, we wouldn't be eligible for HSA. We could still choose to keep the insurance, but opt out of the HRA and take the cash. Is that correct?
That we didn't clarify. Yes, we were in the HRA.
Okay.
The HRA is no longer an option for but to your point, you can say I just don't feel comfortable. I'd rather just keep basically.
Keeping on my spouse's insurance.
But you can enroll in the account too. if you double insure, but you don't get the incentive. So, like I say, we're not pulling insurance, the capability of anybody to be insured through the county. It's a choice they're making, but really, it needs to be an informed decision, because you can choose that as like supplemental, like double coverage or whatever, or I guess it's not double, because if you enroll, you're still, you as the employee, you're the primary. You can have both coverages if you so choose, but really, are you getting the biggest benefit? So, in most cases, I think you can consider, the fine details are going to say it's better for me to opt out.
I don't want my customer
And just go and use them as the primary spouse insurance.
Okay, sorry, I didn't.
Just clarification on what you're saying. So if they decide to stay with the county insurance, they would be on the HSA side now? They won't get any.
If you don't qualify, remember, you have an HRA because you don't qualify for an HSA. Just because we're taking the benefit of the HRA contributions out of the equation, that part of it goes away. You still have the option to enroll in the coverage.
So why? You don't understand HRA law. So what? So the HRA is the extra money. So you're just having to pay more, and your coverage is not going to be as good as you have the HRA. You're still covered to some extent. So.
Right now, the only people that are eligible for the HRA right now are those people that enroll on the plan here, and that they have other coverage, and the other coverage they have is a traditional plan. So for the IRS, they're not eligible to have a health savings account. So as your employee says, I need this health insurance thing, but I have coverage for my spouse, but I want to enroll, so I do. But because of the coverage for my spouse, I can't get ready to save money. So what are you going to do for me? Talking to the county. Well, we'll do an HRA for you. Right? So the HRA was developed for that specific reason, so that the county can still give money to that person who didn't qualify for the HSA.
Is there any other disqualifying factor for the HSA other than the deductibles?
In terms of the plan design,
is having a high deductible plan the only requirement to be eligible for an HSA?
No. You also cannot have first dollar coverage. That's a great question, because there's folks out there who have a $4,000 deductible, but it's not a qualified plan because they can go to the doctor, for example, and pay copay. So all services except for preventive care have to be subject to the deductible to be considered a qualified plan, and then it has to be at least a $1,300 deductible. So.
One more question. So currently we have employees that have OZOI. Both counties. Only one of them is getting the insurance benefit. Is the other one now going to have the opportunity to participate in the opt-out plan and get that amount? So only one person, you have to, the federal government requires you to have insurance. So both people couldn't opt out. Only one person would be eligible to opt out. Fargo right now has coverage. The other one does not, as far as getting the benefit.
So we used to have people that had, we had both spouses, we were paying a full premium for both of them. 2 years ago, we had that situation. But I'm trying to remember if we gave some incentive because they both worked for the county.
There was no benefit.
No incentive. So anyway, that's what we are. So that's one we got to think about.
I guess what my take on that would be, if they're currently eligible for insurance through the county, then they should be eligible for the opt-out program. That would be.
Well, that would be the incumbent benefit they got by having both of them work. I don't know how many couples we have working in one place.
It certainly is costing, could potentially be costing the county more money to have both insured. Mom and all the kids are on insured the county. My dad's insured separately, the county. There's double premiums there. I don't know if that would be the situation somewhere we're in, but it would make more sense for everyone to be on one plan. One person opts out.
Well, that's what we've got. We have any that are married, we have them on one.
Yeah, so they don't both get insurance. They don't both get separate plans.
Do they do additional stuff? No.
So right now, one spouse has benefits, the other one, there's no
Nothing but life insurance.
So the spouse does get life insurance, so that's one benefit.
Yes, they are eligible for the life insurance.
We discussed this scenario, that's unique, but again, we knew that would be something that would have to be.
Well, assuming you know, how many of those couples are there in that position?
Does anybody have any idea how many married couples we have?
Well, there's one couple.
They don't think they're separate.
So are we saying that they would be eligible to?
Well, that's what Katie.
Well, we didn't try to do a study on it.
That would change these numbers again.
Yeah.
Well, only if there's 2 to 3 people or couples.
We know of one off the top of our head.
Well, I've got one.
$8,000
So that's two.
So it's the person.
Oh, that's the other part of the couple. I'm gonna stop now.
To give eligible employees who currently don't see that the $1,500 contribution. When they opt out,
If you weren't gonna give them the
Well, they're not
opt-out
gonna,
option.
if you opt
they don't
out,
have to, they don't have the choice to opt out. They can't.
They don't have anything to opt out.
They can't have two separate policies under the county with both of them working. It's, you know, 'cause it's the same insurance.
because you're paying double for it.
But from what I understood, the county had already previously addressed that, right, is that you have 2 county employees that are married, there's only coverage.
That's one policy.
So, I mean, that's been previously addressed in policy or
Yeah, it's been 4 or 5 years ago. It's became ridiculous to pay $12,000 or $13,000.
Yeah,
One family.
yeah.
Do you think it would make sense to maintain the current policy?
So to answer, I mean, if you're not eligible,
And they can't opt
then
out.
you can't opt out.
You can't opt out.
So, I mean,
They can't opt out.
There's nothing that is opt out.
They should get 3,000 total at 3,000.
As opposed to 1,500, because there's 2 county employees. So we're saying,
Some kind of
Say you're saying.
for that.
I feel like that person was not getting their benefit package.
Right.
Because they're not getting that person.
I don't know how we would do that because the HSA goes along with their insurance policy, so there's no way to give them an HSA without them needing those.
So just to be clear, they wouldn't be losing anything. They would not be eligible for this tremendous benefit, but they wouldn't be losing anything.
They're already losing under the current policy, so we're just saying if there's some way you can fix it, so they're not losing, maybe not to the tune of 7,900, but 1,500.
We could debate if this is broken.
But we can't legally do that, right?
Well, we can't do it as an HSA if you.
We could give them.
Well, we give them a
we've got-
$1,500 benefit in future.
You can give them a discretionary other.
Well, that was kind of the same thing that Bob said, you know, we have that 1,500 kilos for their spouse, if they 1,500 so that, you know, anyway. So, what is the bottom line cost of the county?
That's what it would be now. So people on that. So that's what this means over here. Just it's they're asking us. So this is the cost of the county. That's
So basically, with this 87 and 70, there was much more.
Yes, but it won't be that high.
Those numbers on those spreadsheets. If anything, you should see cost savings increase because either we estimated high or we estimated savings low. We want to disclose that. Again, very conservative. Just trying to practice the savings.
It's good to see you.
Okay, and then that increase is 192,000, so we have a net savings
Yeah, how come the 192 went up to 249?
Josh is going to say the same thing.
I don't have an answer as to why. I just know the 249 is accurate. I'm not sure where the 192 came from. I think that's the one that Rob responded and said there was a calculation.
Originally we were looking at 192.
Yeah, which was
so 249 is accurate.
Okay, so we have 87,000, but then we have 102,000. Okay, how are we going to do information?
I was just going to say, I don't know if it's appropriate. You guys can have the guide right here. I feel like I'm probably
Okay, everybody.
Yeah, keep in mind inexperience here, so I don't mean to overstep or what procedure is, but I feel like I'd be doing a disservice if I didn't at least share some of the concerns that Commissioner Brinker has brought to the table in terms of just discussion. I'm not sure, again, how that works with him not being here or whatever, but I don't want to, like I say, he expressed as a little bit, we're crunching some numbers for him, right before us, why we were kind of delayed a little bit. Is he, again, I'm not sure if further discussion with him would help alleviate maybe some a possible misconception, but he is he's opposed to completely eliminating the HRA. He thinks that should continue to be an option. He's opposed to the restoration of the HSA amounts. He still feels strongly that there should be greater employee contribution.
Okay, we're not eliminating the HRA, right? This is an optional one.
HRA would be optional for HRA would be opt-out, but HRA is not.
what I thought is there was no HRA, no matter. That's over. Nobody will get that.
Correct.
But the person on the HRA could choose to opt out of the county insurance, or they can keep the county insurance, but they're not getting the HRA.
I think it would be more accurate for me to describe that as the HRA contribution. The 15, so the 1,000 that's being put into that account, that is no longer available. Right? We're offsetting those loss of funds with the option to opt out to receive the opt-out benefit in place of those funds.
And I guess you're either going to get $1,000 for the county in an HRA, or you're going to get $6,000 to $7,000. Why would you not take the 6% of
Right, because the only person that would eligible to get the HRA anyway was someone who was enrolled in the health plan and they had double coverage with the traditional plan. Right, there's only 21 people in the county right now who even get the HRA. And it's only because they've enrolled here and they can't get the same money because their other coverage is a traditional.
Well, I guess I'm sorry. I guess and Mr. Brinkerhoff might be, because he's saying not everybody will go with this opt-out.
Yes.
But what choice do they have?
Opt out of the insurance.
Well, they have a choice. It just something like
What is the choice?
The choice is to stay and be double covered, but you don't get the HRA. You can still keep the double coverage if you choose to.
So how does their coverage work if they don't have an HRA or an HSA?
That's just money they used towards medical expenses. They don't have to have that account to have the coverage.
And just to clarify the numbers on my spreadsheet, I met with the building department yesterday, and Reed Erickson does such a great job of making sure numbers are accurate. So this number that you see over here on the savings to the county under removing HRA plan, the majority of that money is actually the savings that the county gets when people opt out from not having to pay the $12,000 premium. Very little of that money is actually removing the HRA. I think you said $1,000 a year for 20 employees is $20,000.
It's $20,000 a year. 1,600. 20,000 per year in county contributions and employee areas.
Yeah. So what we could keep the HRA amount, but we would lose something somewhere else. And when I spoke with those 4 HRA employees, it was Chad Hay, Steve Elatt, Mike Gibbs. They all said that they like this. Now, I haven't spoken to all 21 employees, and we've got a couple here that have HRAs that would give us a good idea too. Yeah, a lot of the sheriff's guys like it. I think when I took a poll, a rough poll, like 4 of them shot up immediately and very excited. So, if we kept the HRA, that is an option. We can keep the HRA and do everything else, but you lose something else. And from what I'm being told by county employees, I've met with about 70 now, I think they would rather see it go somewhere else. So, I wish everybody was here today, because I think I understand hesitation. Anytime you're taking away a benefit, I understand the hesitation. But I think if we had all the information, I think they would come to the same conclusions that I have. So just to clarify that number on there.
I think we have to be careful talking about, losing a benefit, because you're replacing it with something even better, though.
I agree.
It seems like it's kind of a natural evolution. I mean, once we made the jump to HSA, this was probably going to be a step down the road, and it seems like it makes sense to me. I didn't understand it like I did before the meeting. So, anybody else have any panic attack about what's going on? Because I'm not. I feel a lot more comfortable about it than I thought I would.
I think, again, just going back to Commissioner Brinker.
No, I'm sorry. I
Yeah,
couldn't-
right.
No,
Finish that thought. Thank you very much.
It's all in line. He was very clear in terms of, he was just using himself as an example, but he says, he's very clear in saying he didn't want it to be about him. Okay? But in terms of, I think maybe a piece that could use some additional clarification is maybe somebody that's over 65. Okay, so that's that over 65 they have to go to the HRA. Correct.
They're not, if they're low on Medicare, they're not eligible to get it.
Okay, so that's another.
They're going.
Remember how I said there's a couple different scenarios that where we tried to research and kind of look into each one because they're unique and no one person's more important than the other, obviously. But I think maybe it would benefit some, and it's so if someone that becomes eligible for Medicare, that so goes on to the HRA. That goes away. They lose the HRA contribution. They still have the option. Again, I know this is repeating, but I'm just going to clarify. They have the option to enroll still in the insurance that the family offers, but they also have the option just to go buy the supplement. And I think, but change is hard for people sometimes. It's you've had a number of years where you've always just used the county insurance, and you haven't gone the Medicaid route, Medicare route. You're not familiar with the supplement coverage so I think it's that the fear of the unknown sometimes that. So I think it's especially for that part of the employee workforce that is maybe in that scenario that is maybe a little scary because it's going to be a change in terms of how they go about coverage through the supplements that should, but they still, again, from Rob's perspective and previous experience, correct me if I'm wrong, they should still come out far ahead financially. It's just the fear of, well, what about, is that coverage as good as what I have? It's different. So,
but yeah, I agree. And we have Medicare in our offices that handhold each one of those people to the nth degree to help them understand the new system. And quite frankly, there's a reason why Medicare is bankrupt because it's so good. My point being, right? It's confusing to some people, but once they get on it and understand it, and they're able to do so with the off-time bonus.
My mother's 97 years old, and I can't remember the last time I took anything out of pocket.
I may be somewhat off base, but
Been on it for a long time.
that's the assumption that I was in terms of that very quick conversation with Commissioner Ringhoff is that he's using his own experience, and then from that he said, but you can't assume that everyone's going to opt out because they won't. He says you can't use those figures because he says I'm one of them. He says I won't opt out.
Right, but I think it's looked at here.
Why would everybody not opt out? That's why I'm having a struggle with the question I asked before because it comes.
And I know that's the question in everybody's mind is they don't want to be confused. They don't want to make a mistake. Are we making but really, we've tried to.
Well, I'll tell you what, when we're trying to get through the whole discussion, we're going to get Dell on the phone. I'm going to have you two explain everything that we said today to him. Y'all want to hear this now because he's got it all. He's got it all.
I think that too. I've heard that for years, so I think we just offer them. It's already.
Okay, tell me my opinion. What's your opinion, Susan?
I'm a counselor. I don't do that.
You did very well. That's what's your drawing over here?
You have to work with him, you know.
Yeah, for all of us like visuals, artists, right?
I know.
Is this the right number? What is it? 651. This is a bigger number. So you make that 75.
79.
So every bullet point on family contribution for every family outcome by 12. This is right. Am I wrong?
HRA will be an
Even better. Okay, so why one of these one people up here right now are buying the insurance because it's free. Again, free to them, not to the county. And I'm doing that only because I'm getting
I don't
this.
think so.
Okay. Well, if I took away this and replace it with this, who's going to argue with that? If we're remembering the idea, again, the only reason they're even eligible to give the HRA money is because they are double covered. Double coverage over here is what we call a non-qualified heavy deductible health plan. Right, so they enroll here with their spouse, so they're happy, they've already got insurance, probably working, but again, they have the option to get the insurance from the county, it's free. Why wouldn't they? One reason why they want it, let's go there, maybe this plan is a lot better, and that they should take that into consideration. If they're just on this spouse's plan, obviously that's the primary coverage, and if it's a $250 traditional plan with a $10 copay, they may say, I'm still not going to take this even though it's free because I like this world, but there's not many of these plans out there.
So what would be the situation where they was to keep the insurance? And how much do they get paid? They're not going to have the money to pay anything. How many of their bills are they going to have to pay? What percentage? If they're covered there, what actual coverage do they have?
If they're covered, I'm sorry, where?
Well, you said the free insurance.
Okay, so they
they don't have HRA anymore or HSA. They have that insurance. So what does that insurance pay for a person in that
They have
situation?
a great insurance in their
spouse over there.
They just don't get the $1,500.
Well,
The
and there's
insurance
no
rate is the same.
And there's spouse coverage.
The same policy.
Yeah.
Sorry, I'm hung up on
No.
Because there's two. Maybe these people have two coverages. Maybe this will help because my husband works for school district, so he's high deductible, I'm high deductible. So I have a bit of a decision to make. So maybe I thought when I came on board with the county that one of the benefits was both being insured with our employers was the fact that our high deductibles ticked off at the same time. No.
Yeah. The idea of double coverage, it's so tricky because at the end of the day, ultimately it's up to Select Health and whoever your husband's coverage is, and yours is always going to be primary. So if you have your family deductible over here, $3,000, okay, everything goes towards yours first. After you've met your deductible, okay, then if there's monies that you are still owing, okay, then if the coordination works, then Select Health will send that bill over to your secondary coverage. For example, maybe you've met your deductible, now you want to see a doctor. Anyhow, it's very rare that you get much benefit out of double coverage. But this is pretty much the only situation where you might do it because of that and that. Right? You're incentivized to get double coverage. Why wouldn't you? It's free and you get the HRA money. Okay? But in terms of having the benefit of two coverages, very rarely does it make sense to do that. In this case, it does. Again, it's free. You get this. But behind the scenes, you're not going to be seeing much benefit between those two coverages.
Well, I know this year unless something's been done wrong. I've used a lot. So they're doing.
Yeah, behind the scenes. I mean, there's a lot of.
But it depends on if your other insurance is high deductible or traditional.
It does, but.
But don't you think too, so your out-of-pocket max, if your out-of-pocket max on the other plan is less than $7,500, you're still ahead.
Yeah.
Because you're on the other insurance, you're not more than $7,500, the county's giving you $7,500.
Yeah.
So unless you have a really high out-of-pocket max on your other plan, which we did, why would you have insurance? Why would you have insurance?
Right, and you can still come here, just make sure the coverage, still primary for you.
So you might have to pay some money not being double covered, but the county's giving you the.
So to answer
for me is keep us both insured. Get my insurance. Okay.
For right now. But if you get this opt out benefit, that number is much greater than the 83 monthly.
See, there's my confusion because it's about the outcome of it. I understood when Leslie was here that our deductibles ticked off at the same time, so we would end up getting 100% coverage rather than 820 and the 3,000 versus 2,000.
I would never ever say that. Now, behind the scenes, I don't control how the claims are processed, but that's definitely not however how it's ever portrayed to be. Claims come in to select health first, you got your deductible, you have a $380 visit to urgent care, you're paying every penny of that. Then you can go for the deductible. The next day, anyhow, you're paying $3,000.
But what was explained to me though was that 300 tipped off my 3,000 and 500 and things goes no way.
It generally does not do that. Now again, usually,
is that where you bill insurances? Is that what you do? So were you bill for the same procedure?
That's just they all run through one primary carrier, and then the secondary picks up for the primary name.
Okay, well, we have to respect the fact that the elected official and we would like to see him on the phone, you would like to come on the phone, or explain. I don't think you understand the activities of he has. Anyways, and then we'll have a vote. Mr. Jenkins, anybody have anything else they'd like to say before we do that?
I think it was a genius idea to come up with it. Thank you for doing the numbers. Thanks for doing the numbers.
Well, that's true. So we had a pretty good discussion today, but it's going to be tricky with him being on a cell phone and speakerphone, so we'll have to be super quiet once we get him on.
And the microphone is right in the middle of the room, so
well,
right.
No, for him that's that. This microphone's broken and that one fix it. We didn't have one. Do we need any microphone? They're working on it.
We don't have money for that.
Should we point out one quick thing? We've alluded to the spreadsheet that shows the $87,000. It's on there, but we haven't really verbalized it. That number comes with the three things happening: the opt-out, 25% employee contribution for dental vision, and the increase in the HSA contribution. Just three things happen. We just have.
Please, Cedric, we want you two experts. Cindy,
So are you prepared to call for a vote today, regardless of what Commissioner brings to Congress?
I am indeed.
Well,
I want to allow him to.
Are you?
I want you to stay here the whole time.
Okay.
I want to allow him to vote on this, yeah. And it's legal to do that by phone. I wish he was here for the whole discussion, but we're going to give him a condensed version. You two gentlemen. And let's everybody, if we can, remain quiet. Let these two gentlemen discuss, answer his question, and we'll go from there. But I think that some of the things, I don't think he realizes that the HSA can also opt out, and you tell him that. You need to explain to him how it will benefit him, where he's on Medicare, and
removing the age rate still allows people to keep either the 80/20 plan or the buy-up option. It does not affect the insurance. I think he thinks we're eliminating all the insurance, even if they don't want to opt in. And that's not the case.
He's got a pretty good microphone. It's the one on the
Casey, I also think that it would be important to know that it is a great retention and recruitment when we're trying to keep staff and we're competing against state wages.
Right.
We can't get there.
Yeah,
Welcome, Commissioner. We've had a long discussion. We're still here after an hour and a half. We've got Rob Sauer from the insurance company. We've got Adrian. We want those two to explain to you a condensed version of what we talked about today and help to bring you up to speed on a couple of things that we'll find out if you know about them or not. But anyway, there's two or three things that we think maybe you don't have all the information. I definitely didn't have all the information until this meeting. So we'll turn it over to those two to explain exactly what the benefits are that are proposed.
Very good. Thank you for calling.
You bet. Thank you.
This is Rob. Hello, Mr. Ringerhoff. So ultimately, where we've arrived at where we are today, because we have worked over the past 10 days to come up with a way to save the county money. We were here last week and suggested that the county assume the 10% increase in flood health. We left with the mandate to come up with some ways to save some money. So that's what we've done with the help of many people, the room full today. We're proposing three things today. The first thing we'll talk about, because it achieves the greatest savings to the county, would be to stop incentivizing people to enroll in the health insurance who really don't need it. Because that's really what's happening. Right now you have 21 employees who have made a decision that we all would make. We've chosen to enroll in our health insurance plan that is paid for very generously, or said another way, paid for 100% by the county.
You're talking about the HRA.
Indeed.
Go ahead.
So I'm one of your employees, and I look at your plan and say, you know what, I already have insurance through my spouse, it's actually pretty good coverage. I don't need the coverage, but for heaven's sakes, why wouldn't I buy it? The county pays for it, and in addition, I'm going to get money into my HRA because I've enrolled. But you also will have, and do have, employees who have done the same thing, and they're enrolling, even though they have other coverage, they don't really need it. Their other coverage is a HSA eligible plan, so those employees are getting money into an HSA from the county. So in other words, employees who are double covering themselves because it's no cost, and in addition, the county spending monies in the HSAs and HRAs. Again, we've got to understand that I'm one of those 21 people who is getting HRA money. The reason I'm getting the HRA money is, one, because I've enrolled on the plan, and two, because the double coverage I have is not a qualified plan. That's the IRS lingo, right? The IRS lingo is you can only get HSA money if you're enrolled on the qualified plan. So it was really a very generous offer for the county to say, you know what, boy, we're going to have people who don't qualify for this HSA money we want to give them. So what's the IRS tool that we can use to give them money? Well, it's an HRA. So the HRA was therefore developed for those folks, and there's 21 people in that situation. So we would suggest that when given the opportunity, if I'm one of your employees who is presented with the option of not buying the insurance, and in so doing, qualifying for what is called an opt-out benefit, equal to 70, I'm a family, I'm one of your employees that have a family, and I'm given the option to opt out of the county benefits, with the opt-out benefit being a $7,500 a year increase in my wage, and I don't need the coverage because I have coverage elsewhere, why would I not choose to opt out of the health insurance plan and qualify for the $7,500 opt-out benefit? And two-party would be about half of that.
No, 63.
Pardon me, it's 500, right? You're right.
531 a month,
$6,372
$6,372 a year.
So the premise of the opt-out benefit really is a strategic play, which is, boy, we recognize as the county that we have people who are insured that don't need it. And for heaven's sakes, that means we're paying a lot of premium, over $300,000.
Like 14.4 per family.
We're paying a lot of premium for folks who really don't need the insurance. in most situations, there's not much benefit of having double coverage, okay? So the point is, those folks are double covering themselves because they're smart. It doesn't cost anything, and they qualify for the HSA or HRA contribution. So the proposal, as the crutch of our proposal, is to offer the opt-out benefit. The opt-out benefit is equal to the number that I mentioned. More specifically, the opt-out benefit is equal to half of the cost of the insurance policy. The new family...
I'm not just reading all that North Carolina, and if you go point, I'm okay with the opt-out option. I just not content to have a blanket and mandatory what the HRA and all. If you want to get around to having it the opt-out, like you explained, and they'll have employees to the option of staying in, then I'm okay with that.
So appreciate the comment. Perhaps I'll ask you a couple of questions to help understand why you reached that conclusion. And I think one point I would make is we need to understand that HRA money is only accessible to employees of yours who have coverage outside of the county that's not a tradition, that's not an HSA qualified plan.
Okay. I'm not intent to absolutely eliminate all the HRA. If you want to have an option out, I won't do that. Three people with an option.
Okay. So
that's the only point I'm going to make.
Okay. So said differently, what you'd be saying then is, if I'm one of your employees who is, if we solve the HRA, that employee essentially is making the decision that could allow them to stay on the insurance, okay, and could allow them to give the $1,000 into their HRA, or you're suggesting they have the option of saying, not enrolling on the insurance and getting an opt-out benefit of $7,500. That's really the decision that person will be making. If I'm stating differently what you're saying, if we keep the HRA option available, basically an employee is going to be making a decision between getting $7,500 benefit from the county or getting a $1,000 benefit from the county.
Yeah. Leave that option open. I'm okay with that. And the other in case you found, leaving the $1,000 HSA in place, and go ahead with the contribution toward helping toward knocking it down the tail that community, so I'm down a little scattered. So leave the general and an optical in place. That's really an awful thing. That's a different package than an open access package. So I think that's well fine. I know that universities they're paying $250 a check for insurance with a $35 deductible. That's the switch.
3,500 or 35?
Well, you're $35.
So their deductible's way low. We already got it high. We have the highest one.
They have a low 35 deductible. Let's say $125 a check.
So I'd be interested to add that up. So how that stacked up against $3,000 that we had to pay before out of our pocket before we get benefit.
So Commissioner Brinkerhoff, the HRA is a cost to the county of $1,000 a year, and that's for 21 employees. So for the HRA supplement to the health insurance, it's a total of $21,000 a year benefit to employees, which is only $1,000 per employee. That's what we contribute. If we continue to allow people who are using the HRA to maintain their insurance, whether it's the 80/20 or the 100%, does that alleviate your concern as long as they can keep their insurance?
Tell me that again.
So
Walk down the street with a phone.
So we currently have the 80/20 insurance, and then we have the buy-up option to go to 100%. The HR, if an employee can keep their insurance, right? We've all heard that before. You can keep your insurance. 80/20. If they can keep their 80/20 or the buy-up option, but they no longer have the option of the $1,000 reimbursement each year. So it's $1,000 a year. As long as they can keep their insurance, are you okay with that?
I'm somewhat through that. But you still keep the HSA anyway, you know, I miss.
Well, HSA, HSA, yes. And one other thing, people with HSA that have a spouse with other insurance, they can opt out also and receive that extra cash, and then that would be reduce the amount that the county would have to pay for them. Well, that comes down to
Does that need to come from low today? Or you gonna do it
we
one day?
need to, because of the time, they're really going to be really pressed to get everything ready in time, so that's why we made this offer. Made a decision to get you on the phone and give you this condensed version of the long discussion.
They have to submit these changes to, is it MedLife? Is that? LifeMap. We have to submit these changes to LifeMap, and then they put together all of the information before open enrollment begins.
So what difference is going to make today versus Monday?
Well, that's a few days. They've got quite a deadline. It's just going to really put them at an inconvenience.
We did ask. Both Commissioner Adams and myself asked how big of a difference that would make, and Betsy and Adrian both stated that it makes a big difference, and it would be extremely helpful if we made a decision today.
So we actually tell me where the 1,000 versus 1,500 is HSA, is where are we in the proposal now?
The proposal we have is to restore it to 1,500, and our payment for insurance would be $249,780. With all this money come back in an opt-out, we got that clear down to, with adding in the 500 back, we got that clear down to about 87,000. And that's high. That could be high. That would be the high end. That's a conservative estimate.
So the reason why restoring the HSA is important is because that's a $500 cost to the county. However, we're asking the employees to contribute 25% to dental and vision, and the annual cost of that is $316. So while we are restoring the HSA $500, we're asking the employees to cover about $300 of that. So,
300, that's only dental and vision. Nothing to do with the health insurance.
Correct, right. That's a separate issue, but we're asking
because the county doesn't have to pay it all $3.
So that restoring the HSA helps with that additional cost that employees are going to be asked to pay out of pocket, out of their check, for that 25% premium on the dental and vision. So that's why we feel like that's important.
Okay, so the increase for the county, when you do all the quality here, what's the increase cost for the county?
About $85,000 approximately. And if we hadn't done any of this and just went with the original plan or proposal, it would be $249,000, just barely under $250,000.
Well, I thought it was 192.
Well, that was it says 192, but then they didn't have all the figures correct. and it's actually 249. That's basically
Okay, so the 500 HSA is about 70,000 bucks, if I recall.
Correct.
Yeah.
That's assuming now if somebody opts out, if somebody chooses to opt out, then they are not eligible for the HSA. So that $70,000 number is actually the highest. If you assumed everybody continued to do that, that's what that cost would be.
Okay, so here's my around the 99-time question is, to the HSA 1,000, we're almost to a break-even point, and that's what I've been trying to get all along. We're 87 versus that leaves us at 17,000 roughly increase. Correct? 87 to 87? Is that correct?
87 is currently where we're at, yeah.
And 70,000 is the cost of.
Well, 40 to 70, so we've rounded that, or we've averaged that at about 50,000 where the profit come out. That's what they did. Yeah.
I thought the thing I got from the spreadsheet, just some paper showed the back in the 70s.
Yeah, he's got it at 70, but depending on how many people opt out, that would move down from there. But anyway, we can figure it at 70. If that was 70, we didn't restore that, then we would be at 17,000.
And that's where I am. So I don't care how we vote, but that's my position. We HSA at 1,000. We have to eliminate the HRA and provide whatever loans we can. I'm okay with that. So go ahead and do your thing, and whatever we remember, we've always said how much I can count to two.
I already heard that. Anyway. Okay. Thank you, Jeff. Yeah.
That's the position I'm on. And I apologize again for not being fully up to speed. I don't know how I missed this thing all night tonight. But anyway.
We're good. Okay. I would entertain a motion.
Where do I start?
Okay, the motion is that as a county we would implement an opt-out option and provide an incentive to those employees that choose to utilize that option that's been outlined. I don't need to go through all the numbers, I think, for the motion. So we would implement that opt-out option. Number two, that county employees would now be asked to contribute towards the premium at the amount of 25% for dental and vision. That the county would cover the increase in the premiums for the health insurance plans, as was outlined. That we would remove the HRA supplement option. I think that's it. And that we would restore the HSA to what it previously was. $1,500 for the family, and $750 for the single.
Okay, so I will second the order to bring it up for a vote.
Okay, then moved and seconded that we have our insurance plan for 2017 as stated by Commissioner Anderson. I won't repeat all that. All in favor?
Aye.
Aye.
I will vote opposed.
All right, one opposed, motion carries.
Thank you for being available on your trip.
And just so you know, I'm okay with it. That's just one of the politics. I'm okay with it. I appreciate it calling all the work on it, do it, the whole. I get around the other numbers of the slightly shortfall, or $233,000 of the other budget is all out there today.
Okay.
Carry all the upfield. Thank all of you. Thank all of you.
Commissioner, let's plan on sitting down after commission meeting on Monday and going over this so that you can see all the same information that we've received as well. Would that be okay with you?
That'd be great. I appreciate it.
Okay, thank you.
Thanks so much. Right, I would entertain a motion to adjourn. Second. All in favor? Aye. We are adjourned. Thank you, folks. Appreciate being here and all your input. Thanks so much. You're welcome.
Thanks, Tom.
Thank you.
I